what they should do, and they would do it, right? Because this is changing behaviors is the most challenging thing that we do as therapists. And hopefully we can bring some insights from things that we've learned from struggles that people have to make those changes or not, and the experiences as well. As I was having my clinical day today, this lovely lady she's 88 years old that I work with, and I said, I wish I could just take you into the talk with me, because hearing it from someone that goes through it is obviously more powerful. And she said, but you've got some ideas. So hopefully the ideas that we share with you today might be useful. And I will begin by just sharing some slides so that it can help us cue and memorize better what we are discussing. Good. So if we get all this right and technology plays good with us, hopefully you should be seeing the screen and everything should be okay. Yep. So I think the first thing to do is really think about what are we including in this concept of healthy choices. And these are the ones that show up more popular. So I would say if we think about healthy choices, we're thinking about exercise, we're thinking about diet, we're talking about sleep. People would naturally relate it to reducing stress and also social connections. But I would say it can be more complex than this. I mean, imagine working less could be a healthy choice, right? Going to the doctor regularly could be a healthy choice. So I think it can reach to different areas, but these are the ones that are most commonly talked about. And so we will think about these throughout our presentation. One of our key messages throughout this year has been that it's never too early, never too late. And I think this message applies to any of these choices, because we do have some research for specific ones like exercise that show benefits in any stage of the disease. But I think it's pretty common that we would relate to, when I change something, that I'll have a benefit associated to it. If other people become better associated to that changing behavior, then why should I be different, right? So I think there is something that crosses over to each one of these components, and we will touch upon each one of them. As I was mentioning, this is quite complex when you think about making choices, because if you look at this image, we'll think, if I had to choose the healthiest thing that's in this picture, what would we choose? In my culture, because remember, there's a lot of things that are playing. So from Portugal, people would look and say, yeah, definitely a cup of milk is the healthiest thing that you have here. But if we put this in the concept of Parkinson, okay, there's things that we might want to consider. We might want to consider that maybe milk has a lot of protein, and that obviously if it's taken in the intervals of the medication, in the time that you're taking the medication, it might have some interference that we are aware of at this moment. And then if we think about, well, wait a minute, what about coffee? It seems to be here negative, but we do have some research already supporting how coffee might actually be useful for someone that is suffering from sleep attacks after lunch, for example. And it's actually recommended by the Movement Disorder Society as a non-pharmacological strategy. So sometimes the things that seem more obvious are not. And so what this means is, like, how do we help people make these choices? And that is ultimately the question that brings us here today. So our goal would be, how can we help you make these choices? And if I had to say one thing and stay here for our presentation, this would probably be number one. And number one is, at this moment, we can access information quite well, which is a good thing. There's so much information out there, but now it's become a problem because sometimes it's not really accurate. And now we have to develop a new skill, which is, how do I filter through the noise? How do I make sure that what people are telling me to take this vitamin or take this protein or take this, if it's really relevant for my case? And usually health professionals will always be guided by the best evidence that exists. But we do know that if you hear it from someone that also has Parkinson, that there is a direct influence. So people are really motivated by their peers. And it's a pity that sometimes we don't use that more often as health professionals to help convey a message. And so this would definitely be the number one tip, which is find resources in your community where you feel safe. I'll say, Paul, I'll use this word safe to make those choices, and that it would be meaningful into your life.
I think too, it's important to manage this a little bit using the resources like the Parkinson's Foundation in Western Pennsylvania. So your local nonprofit is going to vet a lot of things, and it becomes a great resource because you know that they don't have any ulterior motives. You're not selling anything. So sometimes you can even find information out there that maybe is valuable, but there's also it's coming from someone who's selling a product or something like that. So in addition to the resources that you might be able to get to from your clinician or from some place like Mayo or Cleveland Clinic or something like that, I think especially for local resources, finding your local nonprofit, and then again, the Parkinson's Foundation of Western Pennsylvania, it's probably, well, it is the nonprofit of reference in your area. So start at a place like that, not just Dr. Google.
Yeah, I'd say more than now. I wouldn't say manage. I'm part of several groups with people with Parkinson. I'm there as a friend, not as a health professional, and I try to give my input when I see something. And it's quite interesting to see the sharing of the knowledge that occurs in these groups and how powerful it is, the influence as well. One starts doing something and then the whole group starts doing it as well. Is this negative or not? I'm usually faced with the question of no one has the right to take hope away. And just because we don't have evidence doesn't mean it doesn't work. But we also have to use safety as a measure, which is, does it put you in harm or not? And so we as health professionals will always say, there's no evidence. But nowadays, it's not enough to tell someone with Parkinson, you know what, there's not enough evidence. It's like, let's see how popular this is becoming, and let's see if it works. And we have a good example, which is the boxing, for example, that's used in Parkinson as a form of exercise, which actually the popularity of boxing was superior and outran completely the evidence. People were doing it all over the place and there was absolutely no studies, right? So these are all kind of informations that we just want to highlight. And now if we think about each one of these areas, what would be the key messages that we wanted to convey through our program? If we think about physical activity, not surprising that exercise seems to be something that people will recommend for any problem that you approach. So you go to the doctor and you're complaining about constipation and you say, you know what, you should do more exercise. You go there and you say you're more anxious, do some yoga, do some more exercise. Sleep, the same thing. So it's nice to see that there is a solution that, because it's so it gives a response to so many problems. Sometimes people might not value it so much, right? But it's true. It is ultimately wonderful to see how many key areas of Parkinson that you can see there in the slide: gait, balance, falls, endurance, feeling less fatigued, right? Posture, freezing of gait, which is the feet being glued to the floor. So it really helps. We have more and more evidence showing the benefits over these areas. And this is where this idea came from, which is research studies really showing the difference when they follow people with Parkinson for more than 3 years, 5 years, 10 years, and then understanding that even that the earlier the person starts, when they diagnose with Parkinson, the better they can delay certain onset of problems. And also, even people that were in maybe later stages, they started doing exercise, they also improved. From my clinical experience, usually those are the people that improve most, because they challenged by the inactivity, and just being more stopped and then just moving a little bit more is enough to give such a major improvement. So what we have, and you probably hear this often in several talks about exercise itself, that there are specific areas of types of exercise that you might want to think about, and that should be included into your week. And this is recommendations that are coming out from the Parkinson Foundation, that have published this information that you can access. And basically having an aerobic component, which means exercises like running, walking, boxing, something that really brings your heart rate up, something like strength training. Then you have also another key area where it was placed together: the balance, the agility, and this concept of doing 2 tasks at once. It's placed here in this group basically because it influences mostly balance, where we have more research, but I would say it's present in all the rest as well. And then obviously the flexibility. Now we look at this and we think, I'm challenged by how I'm going to organize my week and put this into sense, right? How can how do I get something, one exercise class where I can have it all? By logic, we should be trying to put this together, or else everyone would be in trouble. They'd be only doing exercise, right? So we have choices. So we have to make choices, right? And it comes back to always knowing what is out there. What are the options? You can see this was an interesting study that I'd like to highlight because they're comparing 10 different types of exercises, which is quite challenging to do this because you are comparing more aerobic exercises compared to more stretching exercises or strength like yoga versus aquatic. I don't think the same level of aerobic exercise is implied in one and all the other, but it's a start. It's a start of showing the types of exercises that showed more benefit for Parkinson's disease. Still, people have to make choices. And when we have these key areas, what happens is, okay, I'm going to try to choose mostly what I like, I think is the criteria that I see often in the groups. And we hear this often as well. But I think it's useful for people to know that we have more evidence that supports one area versus the other. And so it's important to get access to this type of information and how it's growing so that you can make more informed decisions. Because it's not different if you only have 3 hours of exercise per week that you are able to do exercise. If you decide to do only flexibility, imagine how much you are losing by not doing any aerobic component, being that the aerobic exercise is actually linked to delaying progression of disease, right? Which is important for everyone. Everyone wants to grab onto that goal. So it's just making these decisions is sometimes it's might, oh, but this is what I like. That's true. But I'm absolutely sure that if you also will like to have results, and this is how I usually motivate people to, try something different so that you can see, you can try it before saying, I don't like it. Again, changing behaviors is highly challenging. And I live in a country where it's actually more challenging than the people that I meet from the US. I think maybe more education on exercise is stronger in the US, and I see the motivation. It's almost unquestionable that people are not exercising. But knowing Parkinson's disease, I'm pretty sure some people are struggling with keeping up with their exercise. So you might actually start with something and then being able to feel always the same so that you always can perform. As one of the people that I follow says, I don't think that I can perform today at the boxing class, so I'm not going to go, right? So there is a perception that there's a fluctuation of how we do our exercises. And of course, I think knowledge helps you make these choices, but you don't have to be fearful of just reaching out to the health professionals and to specifically analyze your situation and to see what makes sense for the problems that you are dealing with. So it does make some sense to have, a consultation with a physiotherapist or an exercise professional that really knows Parkinson, and they can monitor and help you. When is the time to change? So I started on an exercise routine. When do I make a change? Right?
I think it's good to reinforce that working with someone locally that knows your situation is always valuable. So they're going to help you tailor. It's like we know what generally the research says, and someone was asking about that in the chat. We have a big body of evidence for sure that exercise helps, but to take it to the next level and get to somebody that knows Parkinson's and then has worked with you can help tailor that to even more directly influence what you're trying to address for your Parkinson's and knows when to advance it or progress it.
Yeah. Good. And so, okay, so obviously that's something that exists out there, and I wanted to reinforce that I follow some social media groups as well with Parkinson, and because I think it's a nice way for us to have access to them about what people are complaining about. Some things are not published, and what happens, things that go wrong usually are not published. And so I'm not going to be able to find things that go wrong in exercising. And this is interesting. So this is an example of someone that went into her boxing session, if I'm not mistaken, yes. And basically, as she was doing the exercise, the exercise professional that was there I think naturally we will be saying, it's being lazy, work more on the side. But I got surprised to read that she was surprised that this was a Parkinson's symptom, right? And so it's important for us to be able to think about situations where I can take advantage for helping the professional that's with me to educate them as well, right? So there is a role for the person with Parkinson to help and they get the people that they're working with, giving the right resources as well to learn. And the more they work with people with Parkinson, the more knowledge they will get as well. But working with someone that has knowledge just helps you also feel more confident that if a problem should arise, that they will be able to identify it quickly. I think that's the most important thing about working with someone that knows Parkinson, so that you're not just keeping the same routine. And it's those crisis situations that the quicker we can identify them and tackle them, the more stable and we can keep people without major problems. A key message that I wanted to pass as well is that the research is constantly changing. And so something that we maybe heard about last year that is good for balance training can be changed with new knowledge. So it's good to, even though it's like, I feel I've already heard everything about exercise in these exercise talks, and I'm pretty sure you guys get that often. And it's just making sure that people are adding on new knowledge as well. And so this is just an example of something that we are, as therapists, are thinking more and more, which is in order to train balance, we really have to challenge it. And we have to challenge it, we need to do it in a safe environment. So this is just one of the projects that I am running, because I truly believe that we have to be training more reactive training in terms of balance. And even though I do believe that Tai Chi is really good, I think that when falls happen, it happens fast, and people have to get those skills to be able to react. So this is just an example of looking out for more intense ways and different ways of training the same things. Doesn't invalidate the other ways, it just means that you have more options. Okay, so even if I didn't want to focus this on exercise, this is key messages for each one of the areas. And I think the most important one, and that's why I put physical activity, is thinking about the number of hours that we spend sitting. And I have very severe cases of people that spend almost the whole day sitting down. And then they ask me, why am I worse, or why am I not getting good? And it's very heartbreaking to say, you're not moving enough. And it's as simple as that, right? And so it doesn't mean you're going to have to do physiotherapy. You just need to move, right? Just getting out of, I think the couch is just a key message here. For even if you feel that I can't do those type of exercises that everyone keeps saying that I have to do, but just moving will be very, very helpful. Okay, so that's the key messages on that. And I'll pass it on to John for the diet. Unless there's questions regarding that, but no. You muted, John.
Oh. Yeah, no, pulling it up here. Very good. And everyone can see my slides okay? Yeah, okay, very good. Yeah, it's interesting. I always come back to the Tai Chi. I just saw something recently about it, which was great, but at the same time, it also if it's really done properly to match with the research, often it has to be related to the way they're changing it. And that initial study that came out, I got 12, 13 years ago with Dr. Lee, was highly modified to get those results. I'm always wondering when I see a new program that has evidence in some way, I always want to dig in and realize, okay, what was the methods? Did they change it around? Did they add stuff to it, add another component to it? Before we go, Joseph, I see someone asked how many hours a day should someone be moving around, should be active, not exercise. That's just a different question than exercise.
Yeah. So that study that I was showing is just an example of some studies that I've done, and it's what they put as an average of something negative would be 3 hours, I think, of not moving. As not being, for example, if you have more than 6 hours sitting down, you had more 90% 19% more risk of dying, right? So it's like, and so they saw the estimate was up to 3 hours on the couch seemed to be what they considered okay for this particular thing. That's but there will be different studies and different recommendations. I would usually recommend not for Parkinson's specifically, because if the person's sitting down more than half an hour, the rigidity tends to be more significant. So more than an hour, when you stand up, you will feel more difficulties taking that first step. This would be common, of feeling that the legs are not reacting so much. Even if you are sitting and you're watching a film, you can easily move your feet just a little bit before you decide to move. And I think that just wakes up the brain for the legs and is also seems to be helpful.
Actually, I see someone was doing a little bit of warm-up exercise when they were getting ready for the call too, and I think anything that you can do to integrate some more activity in there, within the guidelines of what Josefa was saying. There's a documentary that came out a while back about the psychologist who was living with Parkinson's, and whenever he was starting to get a little too flat, not as alert as he should have been, he did exercise to make himself more alert. Okay, well, now I'm going to reshare these guys. Here's the diet slides here. Let me pull this up here. There we go. And I'm just going to move them into my presenter mode so I can see everything. Good. Are you able to see my slides?
Yes.
But not the notes. That's what I want. Okay, very good, guys. So diet is something that we get asked about a lot. And I used to say the same thing every time. It's like the great white whale. We all want to have an answer. We can't have an answer. And a lot of it has to do with the fact that diet is very broad and there's a lot of kind of different populations are exposed to different foods. So it's very hard to get a really quantitative answer here. But we do know a couple things. We do know that the Mediterranean diet has the strongest evidence for not only slowing down the emergence of Parkinson's. So if you follow a Mediterranean diet before your diagnosis of Parkinson's, it can actually delay the onset of the presentation of Parkinson's, of the disease showing up. And it's interesting, I don't know why this is so different in men versus women, but it's actually 17.4 years in women versus 8.5 for men. And then the people that are experiencing early symptoms of Parkinson's, think of the constipation or the issues with sleep, or depression or those kind of issues. The ones that appear early in the disease that might appear before the formal diagnosis, before you get the doctor telling you the diagnosis, those also seem to have less of those in those people that are using the Mediterranean diet. And this is it's not as helpful, after the diagnosis to say that, it's kind of like caffeine. People who drink more caffeine have a lower risk of getting Parkinson's, or people who smoke have a lower risk of getting Parkinson's. But I think the manifestation of the disease with the symptoms and the changes in that, it can be valuable to continue that. It certainly, the Mediterranean diet has other benefits with the amount of fiber and healthy oils and lack of sugar. And this is what we're looking at when we're considering the Mediterranean diet. So less red meat, more fish and poultry, olive oil as the primary fat source, not butter. You're limiting dairy in general altogether. And then you're going to include more fruits and vegetables and beans and, whole grains. I think beans are a really great option because they have a nice protein, but they also have a lot of fiber. And so that's one way to look at it. And again, there's no definitive diet. There's no definitive, like, this is what you're going to eat if you have Parkinson's. But a Mediterranean diet is a good place to start. You could move beyond that a little bit and go into what we call the MIND diet, the Mediterranean DASH intervention for neurodegenerative delay. And all this is really kind of a more extreme version of a Mediterranean diet, where you really cut the dairy dramatically and the sugar, which is a source of inflammation. And you up the leafy greens and vegetables, and you don't eat much red meat. Now, the red meat itself is not really an issue, although it's a heavier protein. For people who are dealing with protein interference, which we'll talk about in a moment here, it could be more difficult. But just having more fruits and vegetables can be valuable. There doesn't seem to be any real association with benefits for a vegetarian or a vegan diet. Now, vegan diet means a diet that doesn't have any plant or I'm sorry, any animal products in it whatsoever. So no dairy, no eggs, no meat, of course. And so there's no strong association between risk and vegetarian or vegan diets. But if you're dealing with a lot of gastrointestinal motility issues, maybe it's taking a long time to get through, or maybe you have some constipation, or if you're dealing with GERD, which is fairly common in Parkinson's, these could be good options. And as a matter of fact, if people who are dealing with gastroesophageal reflux disorder or GERD, diet is probably the best way to approach it, as we're finding a lot of the medications for GERD are more problematic. I think whether you want to go Mediterranean, mind, or something more precise, I think you can just follow the basic rules of reducing sweets, fried foods, highly processed foods, things that have been fried, or using hydrogenated oils. Getting rid of as much red meat and dairy as possible, but you can't just get rid of the protein. You need to make sure that you're keeping a fair amount of calories from protein, so you're going to replace those with plant sources or healthier, lower fat meat. And then adding adequate fiber and hydration. And fiber is really important because we know that many or not most people with Parkinson's have issues with constipation. It's one of those early appearing prodromal symptoms I mentioned before. And so you need to have enough fiber in order to make sure that you can avoid that. But at the same time, it's not just fiber, you got to have hydration. If you just take fiber by itself without having enough water, you're not going to solve the constipation issue. You're actually going to make it worse. Another reason why we like hydration is that it does seem to have an influence on what we call hypotension. Hypo meaning lack of tension, referring to the blood pressure. And in Parkinson's in general, people tend to have lower blood pressure, and some of the medications can make that even more pronounced. So by keeping enough water in your system, you're working against that. And it will also help the way the medications work. So when you're taking your medications, I always encourage everyone to drink a full glass of water. And I'm not talking about a huge water bottle full of this. I'm just talking about a nice 8-ounce glass. And that's a great way to make sure that you're getting extra hydration, and that when that medication is going into your system, it's getting enough liquid to help it disperse properly and give you the best effect. I mentioned this before, interference with levodopa and protein. It's a common issue that people talk about a lot, but it's one of these things where maybe it gets shared more in the media or in the social networks, and it's actually not quite as prominent an issue early on, particularly. And the reason why I say that is it's the kind of thing that if you think you're dealing with it, have a conversation with your doctor, because they can take some measures to address it. And generally what happens is the protein, after you eat your food and it goes down in your stomach and it gets absorbed, and then it goes through the pyloric sphincter into the intestine. That's where it starts to get absorbed into your body. That area right below there, the duodenum, is also where all of the levodopa gets absorbed as well. Matter of fact, if you take duodopa, if you take the pump, it puts that right into the duodenum as well, because it knows that that's where the medication is being absorbed. So if you're eating a high protein diet, then when it comes out under the pyloric sphincter, it may block the medication. The food will be preferentially taken up, and the medication will just pass through your system. So I don't want people to worry about this too much. And again, I think it's something where we've talked about it a lot, and people get really too cautious, and maybe even start to get rid of protein in their diet or move it around so much that they don't get enough protein. And that's definitely not what we want. So just some basic guidelines that everyone should follow is try to take your medication at least 30 minutes before or 2 hours after a meal. And if that doesn't seem like it's sufficient, then maybe consider 60 minutes before and 3 hours after. But if it's becoming an issue that is interfering with your management of your Parkinson's, then it's really time to have a conversation with the doctor, because the doctor can change the formulation of the medications. It might change the timing, But those are all things that you wouldn't want to wing. You don't want to do that on your own. You want to have a little bit of input, and the doctor should be aware that maybe this is a problem that's starting, that they'll want to also ask about it at every follow-up appointment to make sure it's not encroaching on your day-to-day life. So it's not a hypothetical problem, but it's not as big a problem as I think everyone presumes. I just see something in chat, so I'm going to watch it real quick. Just to check here. Someone asked, doesn't long-term use of carbidopa levodopa lead to hypotension even if you are hydrated? Yes, I mean that's the issue of that specific medication does cause some hypotension. That's the Cinemet and all the generic variants. And so yes, that's an issue, and the hydration won't affect that. That's quite true. But it does help with some of the other factors. So there are some things that you won't be able to solve. This is again back to doctor stuff, because maybe they'll give you medication that puts it in a more slow release formulation, whether you're taking one of the controlled release versions or something else, or they could add a medication that's not carbidopa levodopa, and that might also give you some benefit without having that same issue, because the dopamine agonists don't really have that same issue, although they have their own set of side effects. And I want to be cautious because I'm an SLP. I know this area, but I don't know it like a doctor, and I don't know your medical side of it. So again, these are kind of doctor questions, and if you're thinking that you're dealing with issues, either maybe you're getting lightheaded or feeling hypotensive after that, that's a definite call to the doctor's office, at least a message in my chart, and probably something to address at your next session with them. Okay, I see one more here. So there's another one in here. How do I know if I have this problem with protein? And Josefa, I'd be interested in, I mean, you see so many people, I think people just start talking about their medications not feeling like they're kicking in that day, or they're having an off session,
Yes.
right? What do you
Yes,
see?
I'll probably share that sometimes people have the feeling that there's a dosage throughout the day that doesn't really work as well. Usually it's the lunch one. But this in Portugal, we have very dense lunches. It's a meal with meat and fish and chips and stuff. We sit down for the meal for 1 hour. So it's usually associated, that's a time that you can, and the doctors will usually tell the person to, take it at breakfast, lunch, and dinner. This is the most common prescription that I see. And then the evidence started showing this interference, and some of them are now highlighting, you know what, if you want to take better benefit of the medication, so you don't have to actually perceive the problem, because we know now, we have enough knowledge in terms of evidence to say, if you do take it out of your medication, of your eating, then you'll probably have longer lasting benefit, right? So it does benefit even if you don't feel, and the natural progression of the disease, people take the medication and they're not supposed to be feeling these fluctuations, right? What is this fluctuation? Is these on-off phenomena, is basically the medication not doing what it's supposed to do, right? It doesn't have enough effect to last you the interval that the doctor has prescribed. And so that's when you might feel more fatigued. It depends on your specific more Parkinson's symptom. So it could be fatigue. Some people could be non-motor issues like anxiety. It starts becoming worse, right? So the off phenomena is something that is very targeted in terms of research. But specifically for adopting this change, it is something that we are comfortable already saying that if you do take it out of your meals, then you probably will feel more effect. And that, what does that mean in the long run? It means that you won't have to increase so much later on, right? So the more we can make it potentialize the use of the levodopa, the better, right? So we don't have to increase it. I hope that helps with the.
Yeah, and I think you're reporting that, like, if there's a certain time of the day when the medications just don't seem to be working, or if you start noticing that maybe if you have certain items, whether you have something that has a lot of protein in it, seems like it's throwing off that particular dose. And you point to something important, which is people sometimes will move their highest, heaviest protein meal to later in the day, because that's when maybe they don't need as much mobility as they need for day to day in and out, in the morning and afternoon.
Yeah.
Um,
Well, I have often situations like the person it seems like in the morning I'm taking too long to be able to actually be active. And I
yeah.
said, yeah, what do you take for breakfast? And it's usually a cup of milk, right? Or with cereal. And he's like, have you ever considered taking tea? So this is natural talk between therapists and the person with Parkinson, and the person trying out maybe drinking tea instead of milk or drinking coffee, and suddenly the problem disappeared, which is great. That means when he goes to the doctor, he doesn't have that problem. But that doesn't mean that 6 months after he wouldn't be dealing with that, because unfortunately we know we're fighting against the progression of the disease. But it does mean that we are delaying the problem.
Yeah, and you also get to another area that's interesting. Someone asked a question here about any foods that increase dyskinesia. But before I say that, you talk about sources of protein, that maybe some sources of protein, especially plant-based sources, that might not cause as much difficulty. So again, it might be a way to work around and delay having to either increase your medication timing or increase your medication dosage, or change the timing, or move to a controlled release formulation. It's interesting so dyskinesias are movements. They're unpredictable, what we call choreic movements of the arms usually, but also the upper body and the head. And they're caused by an excess amount of dopamine in your system. So they're a side effect of the medication, not a symptom of the Parkinson's. And they're most frequently treated by managing how much and how fast the medication you're getting. Either you're taking smaller doses more frequently, you're taking a controlled release formulation, you're adding in a COMT inhibitor like entacapone or opicapone or something like that. So a food that would increase dyskinesia would be one that has dopamine in it. And of the ones that we might actually eat, unless you're taking mucunapurians as a supplement, which is a supplement that contains levodopa, I think fava beans are the only thing that I know of that actually have a fair amount of dopamine or levodopa in them. Levodopa being the precursor, and so it's not likely, that I won't say you couldn't control your dyskinesias with your diet. You could if you wanted to blunt it with protein, but that's not what I would do. I'd say if you're experiencing dyskinesia, it's probably time to talk with the doctor about ways to manage it pharmacologically, because they're going to have better solutions than you're going to be able to do with your diet. So yes, it's possible, but it's highly unlikely. I mean, not highly unlikely. It's not that common.
I'd say
Can
we
you
don't know if they can.
Yeah, we don't know. Yeah. Can you get rid of Cinnamon-induced hypotension by reducing the total amount of Cinnamon you are taking? Boy, I want to be careful, guys, because there's too many answers that are part of that.
I would
Doctor?
share that there's
Yeah.
a reason why the doctor has prescribed you that medication, and the reason is to give you more quality of life.
Yep.
And every medication comes with a price, and it does have the adverse events. But it's a question of being able to balance that. It's like, can I live with the side effects that sometimes happen or not? It's really a discussion to have with the doctor. In a sense, yes, it could ultimately do that, but at what cost? If you reduce your medication, then you might have other issues. So it's not an easy one to answer directly. Okay.
Yeah, and one to be careful with. Let me just make a little plug here for this is why I would prefer, if I was dealing with Parkinson's myself, prefer to work with a movement disorders specialist, at least as a consult. If you can't get access to one regularly, at least as a consult. But if you are able to work with a movement disorders specialist, they're going to know the 26 different formulations of dopamine replacement medications and be able to come up with a good solution for you, rather than just kind of throwing the basic treatment. Cinnamon probably be the real basic one.
Yeah,
So
but
was
I
it?
think not creating fear
Yeah.
in terms of it is a highly efficacious medication. It is one of the most, it's the standard one, it's the strongest one that doctors have to help you.
The
So
gold
it's
standard.
good to have that
Yeah.
conversation so you don't fear it.
Quite the opposite. Yeah. I mean, I think we talk about levodopaphobia, and levodopa is the active ingredient in Cinemet. And all the research seems to show that it is the gold standard, most efficacious. So that's why the doctor's using it. There are other ways to get around it with other medications, but they all have their own side effects. So your answer is theoretically yes, but only after you had a good conversation with your doctor about the pros and cons and the benefits. And don't fear the Cinemet. It's really doing a lot for you. Someone said moving from to a non-dairy creamer had an improvement in their tremor, and I said, "Oh, that's interesting." I think I like non dairy's an animal product, so it's got its own issues. So moving to non-dairy, non-animal products is probably valuable for a lot of stuff.
Okay.
Okay, I want to just keep moving, guys, so I don't run out of time. But I think we're doing actually a good job of catching these chats in a way. So if we don't get to tons of questions at the end, I think we will have answered everything along there. So I think there we go. Nope. Okay, so malnutrition is another issue that we always try to be on guard for, especially I'm an SLP, but Josefa sees everything under the sun. So you can have changes in your weight that you weren't intending, and most people aren't on a diet when they're dealing with Parkinson's, but you can be, I guess. But if you're having weight loss that you weren't intending to have, then I'd start by looking at whether you're having difficulty at meal times getting enough calories in, whether that's due to chewing and swallowing, or whether that's due to getting the food from the plate to your mouth. These are different issues that are often common. Fine motor issues or problems like that can make it difficult. Digestion and gastrointestinal issues, whether that's the GERD we talked about before, or the constipation. There's a lot of motility issues. And even if you're dealing with a lot of dyskinesias and even disease-related stress, that can burn some more calories, although that wouldn't be the primary source. I'd be looking for difficulty getting the calories in first before I start thinking they're doing so much movement that they're exercising all the time, essentially. But sometimes you see people that have a lot of movements, and maybe that's a factor. So again, that's something to be aware of, and you'll want to find ways to supplement that diet and make sure you're getting enough calories in. And when you do, it's really important that you focus on things that have lots of nutrients. So sure, you could increase your daily ice cream intake and increase your calories, but that's not going to have very much fiber. It's not going to have a lot of other benefits. It's going to have a lot of fat and sugar, and not to mention the dairy. So when you're trying to find ways to increase your caloric intake, whole foods, nuts are a great source of protein. Again, plant source. Even dried fruit can have a lot of bulk in there. Beans has a lot of bulk in it. So there's a lot of ways to do it, but avoid thinking that you're going to do, just eat a bunch of candy or something like that, because you'll get plenty of calories. Drink a lot of Coke, you'll get a lot of calories, but it won't necessarily have the benefits that you want. I don't think Coca-Cola is part of the Mediterranean diet anywhere, even though it happens. So I'm going to pass it over to you. Here we go.
Yeah, so we have sleep. You can put.
There we go. I don't want my computer so slow. There we go. So, sleep is an issue that many people, someone just asked me about fava beans. Let me switch before we go here. So they just asked whether fava beans would be safe for someone who has just been diagnosed, but not, and I lost my chat, but I will say this. Can you see it?
I can comment on that. I've had that experience. So.
Yeah. Okay. Well, you got it. You do that, because
Yeah. So it was someone that just got diagnosed, and she was actually from Holland and came and lived to Portugal. And the neurologist writes me a letter and says, Joseph, it's up to you, because the person doesn't want to take any medication. And so I've just prescribed her fava beans. So yeah, so I guess at that time, this was a couple of years ago, we didn't have the neurologist doesn't have enough evidence to say, you know what, this medication, starting the medication is important. And just from this year and last year, they do have that evidence. So we do already have research showing that the benefits of starting earlier. And so you can have a more productive discussion with the doctor about that if you early diagnose, because we know that there's a lot of fear of not starting the medication because you hear about the side effects, and obviously that doesn't motivate you. But the truth is, it is really highly efficacious. It will improve your quality of life. And now we can actually say, and we also have evidence to support that in the long run it's going to be better.
And a couple parts to that, because on the one hand, old studies, 30 some years ago studies, were wondering whether levodopa, you would get to a certain level and you couldn't take anymore and all that kind of stuff. That's all been debunked. And if you do take proper amounts of Cinemet or other medications early on, you're more physically active, you do more exercise, and that has long-term 10 years, 10, 20 years down the road benefits, because people who are more physically active have a slower rate of progression over time. They're also at lower risk of falls. And I just want to go back and forth. I said fava beans. Fava beans are something that people can get at a grocery store or at a market, but also there's a velvet bean, which is called mucuna pruriens, and it's usually only sold in a supplement. So I don't want to conflate the two. People do take mucuna as a supplement, and it's basically Cinemet without the carbidopa. But I have not seen people be able to do that in lieu of medications. And if they did, I don't think that they're getting better results. So I want to be real careful. I think what
The
Josefa
con-
did. Go ahead.
yeah, the concern usually in the doctors that I work with is that when you do take those type of products, we can't really control the amount of levodopa that people are receiving, right? So
Yep.
it's they can't really understand what is the dose. So to be able to prescribe it in the future is like, how we're gonna increase one fava bean, two fava, so it makes it more challenging for them.
Yeah, we better.
So I think jumping onto another key area obviously is sleep, and there's a lot obviously that we can discuss. This Congress is only on sleep, so just key messages that we want to highlight. This is the most common complaint, which is the person can actually fall asleep quite quickly, but during the night they wake up and they can't fall back asleep. So this would be the most common, and this means that your sleep is fragmented and that you're not getting into the right cycles of sleep. So we could go into more depth on that, but we'd want to just do a quick exercise on thinking about how can I do something about it, right? So how can me as a person with Parkinson be able to change something or make some choices that will help me improve the difficulties that I might have at sleep. Important to reference is what might be happening if you're waking up in the middle of the night and you have your symptoms that are specific to you, like more rigidity or even tremor or pain is happening. It's probably related because think about when was the last time before bed that you took the medication, right? So that means that the effect is not lasting through the night. And so what people are really waking up to is a moment where the medication is not working as it should. And there's so many options that the doctor can do to help you with that, because there's different formats of medication that can help you last through the whole night. So it's a key message is like try to identify what is reversible, right? So it's just, if this is happening, it's important for us to, I usually do this type of drawing when someone goes to the doctor and they're having challenges. I do it with the person with Parkinson. Let's sit down and let's do this map. Let me understand what's happening through the night. And so this will guide the doctor in taking better decisions as well, and being able to, for the person to also tell his story better, to understand that he's waking up maybe 2-3 times per night, but he's not able to then fall back asleep, or he goes to the couch during the middle of the night. So if we see a typical example, things to think about before dinner, one of the recommendations is usually to, try to avoid late afternoon naps, right? And so I think these are the common things that you hear about to be able to control some or manage sleep better. So things that are obvious that would influence. I think it's we have recommendations for about 30 minutes, maximum 1 hour of a nap. In Portugal and Spain, this is a very common thing before 3 o'clock. So it's the doctors really have to think about this because it's common in our culture for people to have naps. And then if we think about, okay, so I have dinner, and this is more American dinner at 7 o'clock. Is there something specific that I can think about? I eat after I have dinner. What do people usually do? So obviously different cultures, most common people will sit on the couch and maybe watch a film or something. And what happens sometimes is they actually fall asleep on the couch. So you have very deep sleep in right after eating, which might interfere. Then they go to bed and they wake up, or they have more difficulty with the sleep. So that's something to think about. How active am I? And I know that people can't be, doing exercise after dinner, right? So it's just being mindful, but, playing a guitar or doing some kind of hobby, something that will keep you active, that will avoid getting those naps after, in case this is happening. And then allowing, because at the same time, we don't want people to fall asleep on the couch, but we do want people to maybe not be watching news about, I don't know, Third World War, unfortunately. All these, the news is very upsetting at all levels at this moment. And so before we go to bed, maybe consider what type of activities are we doing, would be something else to consider. Typical things that you might also hear about, how the light from our phones, people are spending a lot of time on their phones, and so that means that the type of light that you are exposed to before bed makes your brain think that it's still daylight. So there's a lot of already evidence to help us give this recommendation about trying to avoid that. And strategies like changing the density of the light or something, and the type of having these glasses that will help you make it more adequate. So you can consider many things. There's a lot of strategies for people to implement. We think about things like not drinking until, the recommendation that we get here is until 6 o'clock at night. Try to get all your drinking done until then, and then try to avoid drinking. But remember, we go to bed at midnight, typically in Portugal. So I was just saying, just making sure that the drinking might not be waking you up during the night to go 2 or 3 times to the toilet. It all seems very logical things, right? But sometimes we don't put them together and to help us to think about them. One of the curious things is, and that there was not some consensus for a while about this, so the sleep doctors would say something, the neurologists another, but I think now it's more consensual that we have that if you are unable to sleep, that you shouldn't stay in bed, at least more than half an hour. Don't stay in bed looking at the sky. Most by experience that people tell me is if you get up, maybe they go to the couch for a while and read something, they might even fall asleep and do a couple of hours on the sofa, and then they go back to bed and they fall asleep. So people are dealing with this issue in very different ways, but it's just like staying in bed seems to be the worst thing that they can do. And I think I had another one about if obviously there are sleep issues that are more complex, and there might be the need for people to adjust their environment so they can make it safer. But as I said, this is a very complex topic that could take us through another hour. Keeping our key messages regarding sleep that I would like to highlight is because people are living this every day and I would say, bearing it or tolerant to it, you might not consider approaching it and talking about it with your neurologist. And this is very important so that we can identify these problems early on, so we can manage them. As you can see, there's lots of options of how to manage it. So being able to identify it is fundamental key message here. And coming down to our last one in terms of socialization, I just want to share that again, we have more and more studies. This was one that I particularly like, which is comparing, where people would have their physiotherapy and exercise. And one of the things that was interesting to see in the group section was that people actually improved in cognition, even more in social cognition, which is very important in group formats. So there's things for us to support, evidence to support us to saying that socializing, like the exercise, is a good excuse for us to be able to be social, right? We don't have to go out for coffee or if we don't feel like it, but go into a group in activity, and I think in other activities like walking, it helps us keep our bodies well and also our minds well. So obviously this would be a suggestion that more and more we have options for community exercise, which is great that people have these options. I'm still from a time when none of this existed. So I think we have nice tools to be able to keep people healthy. And the final key message here is just recognizing that there are barriers to changing behavior. It's very, very challenging. And so people have to be patient. And I think also a key message here for families and care partners, which is you're not doing this, and the person is actually suffering from apathy and lack of initiative and won't be able to do it, and will always be feeling like he's failing because there's something that's more underlining. So we have so much to deal with. We have so many factors that can play in terms of health issues. Specific things for Parkinson I think are very challenging, which would be the depression, the apathy, that above all fluctuates, right? So there might be times where you are more motivated to uphold to some of the choices and healthy things to do, but it could be a day, one day you just don't feel like it. I usually tell the people I work with is like more than 3 days, then we have a problem. Okay, you can have one bad day, but do keep in mind that more than 3 days something's happening and we have to to help you find that barrier. If we identify the problem, we can probably change it. Other things play a lot. Environment. If you have access to, for example, exercise classes, of course, then you'll do it easier, right? This is not an issue now because you have things online as well. But yeah, I just this could also go into depth, but this is a key message, and I want to keep here. Our message to finalize our series is really all this idea about staying moving. Moving would be the first one. Keep moving. Trying to focus if you can eat well, monitoring your symptoms, identifying the problems, I think has always been something very strong. Being able to act quickly on the problem, and yeah, and socializing for sure.
Yeah, and as far as the socializing and getting access to good exercise, again, I'm going to go back to the Parkinson's Foundation in Western Pennsylvania. They have a lot of resources. They do an awful lot of in-person classes as well as online. They have a class with Josefa, I'm not thinking about it, on Wednesdays, a Zumba class, but they have a lot of in-person classes as well as support groups and other opportunities to meet up. I think that we're learning more and more that loneliness and a lack of or social isolation are two really big factors in quality of life in Parkinson's. And so anything you can do to address that, it's going to have a lot of value, period, but it's going to actually have impact on your Parkinson's over time.
Yeah. So even if we don't feel like getting out,
Yeah.
we don't have to say anything. It's good when it's only people, but you don't have to say anything. You just have to be there, right?
Seeing people. I mean, I know that too. When I'm working too much at the computer, it's like get outside and all of a sudden the whole world changes. You get back into a different kind of mindset. I think, did we get to everything, Casey? Were there anything in the chat we missed?
I didn't notice any. Certainly, if there's any last questions, John and Josefa have a few minutes.
I saw one again talking about reducing Cinemet to address hypotension. I just want to be real careful that people understand that hypotension is also a symptom of that low blood pressure, especially the orthostatic when you get up and then your blood pressure goes down. That's also just a symptom of Parkinson's, and there are medications that doctors can prescribe to address that specifically. So again, just to kind of combat potential levodopaphobia, make sure you understand that. And also, if you're dealing with that, talk about it with the doctor.
Thank you both. This was an excellent way to conclude the year. I think all of us have picked up a few tips to set those healthy goals, and we appreciate both of you so much. And you certainly can try Zumba with Josefa. That's tomorrow.
Keeping our bodies healthy and minds.
Yes.
You are very welcome to come, and yeah, it's always it's all about letting loose and having some fun with music.
That's fun class. Donna, did you have your hand up? Did you have something you wanted to add, or is that just you're playing with you?
High five. Nope, I bet she has a question.
Yeah.
You have the floor.
I just had a question on I know someone was asking if they haven't started meds yet. And have you guys heard of the 201trial.com that's testing out? It's a phase 2 clinical trial being run in the United States that's testing out a new medicine that can slow the Parkinson's down or maybe completely restore it, but it's only for people that have not started any medicines and they have a diagnosis of Parkinson's.
You said
so I know Irene was asking about that, so I just wanted to bring that up.
And it's called the thing is called 201. Is that where you found it? What is it called again?
It's called the 201 trial. www.the201trial.com. The 201 is in numbers, and it's on the clinicaltrials.gov website.
That's back. Okay, so if it's listed on clinical trials, that's usually a good sign of it. We're looking for what's called a neuroprotective objects out there, items out there, and so there's not anything out there that has been determined to be. I know they were looking at for MAOB inhibitors in the past. So it's worth checking out. I don't think it's worth not taking your meds just so you can qualify for something like that. But if you're in that boat,
No, I'm not saying that. Yeah, no.
But a phase 2 clinical trial is still in the world of research, you have a safety one, that's a phase 1. Phase 2 is you're figuring out possible doses sometimes, and you're also checking safety as well. It's really when phase 3 trials start showing promising results that I start getting interested, because that's probably when they might make it their way into actual pharmacological product. So yeah, so it's worth checking out. I'll have to look it up. I'm not familiar with it, but I'm interested. I tried to get involved in a study that was repositioning a medication a while back, and the same situation. But again, phase 2, there have been a lot of phase 2 trials that didn't actually make it to the next level. So it's still fairly early, but it's cool. I'll check it out. The 201 trial.
Yeah.
Thanks.
Mhm. All right. Well, I think we're out of time.
Oh, there
It
you
was
go.
wonderful as always. All of the past webinars by John and Josefa are on our YouTube channel. You can watch all 5.
Yeah.
And have a great day and month, and we'll see you all soon.
Yeah.
Thanks for having us.
Don't forget the last key message, like
Yes.
it's never too late.
It's true.
Yeah, that's good
We have
answer.
programs, there's virtual, in person. You can
Yeah.
start tomorrow.
Yeah.
Bye, everybody.
Bye-bye. Thank
Thank you all
you.
for coming in.
Thank you.